Hi friends, I'm just recording this video today because something came to my attention early last week and it's so important that I think everyone should know about it. But before I go ahead to talk about what I want to talk about today, I want to say in full disclosure that I am a scientist by education, by training and by profession, and so I am not against vaccines. I am not against the immunization of children, but I would like to add to that I am very much for safe and ethical vaccinations, and I am very much against the way some pharmaceutical companies have tested in the past or trialed some of their vaccines and drugs in the past, where they're going to populations, poorer people. They are sometimes going to African countries and they are trialing their drugs and devices and vaccinations. And they are doing it in such a way that they can act with impunity. They are going to populations where people are so poor or so powerless that they cannot come back, to fight them should anything go wrong. This is a low risk that they take, and they are doing it with impunity and almost no oversight. So now to what I want to talk about today. It was back in April that, I think it was exactly on the 4th of April, that's when I saw this video. We saw this video, outrageous video that came out from a French television. Now, the man speaking is Dr. Jean-Paul Mirat, and he is a doctor and I think a researcher in a French institution. Now, listen to what he says. It's in French, but I was so fortunate to have found a subtitled version of it, so you can at least follow what he's saying and see how outrageous it is.
Si je peux être provocateur, est-ce qu'on ne devrait pas faire cette étude en Afrique, où il n'y a pas de masque, pas de traitement, pas de réanimation, un peu comme c'est fait d'ailleurs pour certaines études dans le sida, où chez les prostituées, on essaye des choses parce qu'on sait qu'elles sont hautement exposées et elles ne se protègent pas. Qu'est-ce que vous en pensez ?
Alors vous avez raison, et d'ailleurs on est en train de réfléchir en parallèle à une étude en Afrique justement pour faire ce même type d'approche avec le BCG, un placebo. Je pense qu'il y a un appel d'offres qui est sorti, il va sortir, et je pense qu'on va en effet...
Did you see that? The way Jean-Paul Mirat was talking about Africans, like we are lab rats and we are, guinea pigs, that they can do whatever it is they've done with us because we don't have any mask, we don't have any treatment, we don't have any resources in Africa, so they can do their testing on us, like they've done with prostitutes in the past, like they've done with HIV/AIDS. It's incredible. Now, when this video went online, very fortunately, it raised a lot of outrage. People were very upset about it. People from every part of the world. I saw people texting about it and talking about it and tweeting about it from, America, United Kingdom, from France, from different parts of the world. But most especially, what really, really encouraged me was that people rose up in Africa. Africans themselves went online and they were texting, they were talking, they were tweeting and putting things on Facebook and saying, we don't want to be lab rats. We don't want to have anything to do with the coronavirus drug testing or vaccine testing. Do not test us. So there was an obvious pushback, an obvious objection, rightly so, by the African people and, people of goodwill from everywhere around the world. So we fast forward to 2 months later when a research group at the Oxford University came up with a brand new vaccine against the coronavirus. They called it the ChAdOx1N-COVID-19. A mouthful, right? I know. So, but they started talking about trialing the vaccine and testing it so they can go ahead and do a mass production of it. And it's in the UK, right? This is Oxford University. So we're not supposed to worry about what Jean-Paul Mirat was talking about back in April, right? Wrong. This is actually what I picked up early last week on a South African news station, and I just couldn't believe my eyes. And in fact, it was because of this particular news that I picked up. That was why I decided to make this video today. Now, listen to this.
Hospital in Johannesburg, Junior Mhlongo is being injected with a potentially life-saving treatment against the new coronavirus. He's volunteered for the first human trials of a vaccine to take place in Africa.
I feel a little bit scared But I want to know what's going on with this vaccine so that I can tell my friends and others what's going on in this study.
The trial, being carried out by Britain's Oxford University alongside local partner University of the Witwatersrand, will consist of 2,000 volunteers, including some HIV-positive patients. They'll be monitored over the next 12 months to see how well the vaccine protects against COVID-19. Shabir Mahdi, a professor of vaccinology at Wits University, says the aim is to get the infection rate under 1, the level at which it starts spreading rapidly.
But once there's 60% of the population, especially the adult population, that becomes immune, we expect that effectively productive rate to go to under 1, which basically means the virus will still be around, it will still circulate, but its chain of transmission has been interrupted, which is important.
It's the second trial of this vaccine outside the United Kingdom after Brazil, and a larger study is planned in the United States. South Africa has the highest rate of infections in Africa at over 100,000, with 2,000 deaths, and the World Health Organization has warned the region could become the next epicenter of the outbreak. Though tests of a new medical intervention on the continent always ring alarm bells because of a history of big pharmaceutical companies using Africans as guinea pigs, it's hoped that South Africa's involvement will ensure the continent will have access to an affordable vaccine and not be left at the back of the queue.
Friends, can you just believe this? Can you believe this? I couldn't believe it when I watched this last week on a South African news station, particularly because the Africans themselves said it very clearly. People were pushing back, rejecting the idea that any African country should be used as a trial ground for any pharmaceutical company or any research group for the coronavirus. People rejected it, so nobody can say, oh, we didn't know, or there was nothing that came out about it. People were on social media just back in April using hashtag like Africans are not guinea pigs, Africa is not your dumping ground. People were saying all of this very clearly, and yet this research group at Oxford University in the United Kingdom still found their way all the way to Africa to do the low-risk testing. And of course, as you know, I call this low risk, not because it's low risk to the people who are being used as lab rats in Africa, but it is low risk for the researchers and the pharmaceutical companies themselves, because if anything were to go wrong, how will these poor people in South Africa be fighting against them, or how would they be able to get back at them or sue them if, should there be any need? And did you notice in that news clip that it seemed as if the neighborhood or the area or population that was targeted by this particular research, it's the poor people. It's the poor people in South Africa. It's probably people from maybe slums or maybe poorer neighborhoods. They didn't go to the suburbs. They didn't go to the university communities. They went to the poor people who will be absolute low risk for the researchers themselves. So this brought a lot of questions to my mind, actually, because I was just asking, so who is paying for this trial? Who is leading these, these efforts to do their testing in South Africa? Is it the South African government? Are they the ones paying or footing the bill? So I started watching more clips coming out of South Africa, especially last week, because it seemed as if because of the trial was announced, they had to do so many things in the news at some point last week, at different points last week, actually, to explain to people what was going on. So this was a news panel that I caught on one of the South African stations. Again, it's a much longer panel, and if you want, you can go to YouTube and watch the entire thing. I think it's up to an hour long, but I only took a few seconds of it because that was exactly the clip that answered my main question. Who is funding this research? Who is funding the trialing of vaccines on South Africans? Who? So this is the clip, and as I said, there's many people on it, but this particular woman that I'm going to be showing now is Professor Glenda Gray, and she is the president of the South African Medical Research Council. Apparently they deal with research, but she was the one that actually gave us a good insight as to who exactly is funding it, whose money exactly is being used to empower the people who are coming to dump and test this on Africans.
the announcement of the first coronavirus vaccine to be studied in Africa, and indeed in South Africa. So the South African Medical Research Council is a major funder of this program. What's very important as well is the issue around prevention, and we became very interested in funding work on vaccine design and development. And we looked at both local vaccine design and development as well as collaborating with international groups. And so this is the reason why we have collaborated with the Gates Foundation to fund this very important research.
Thank you so much, Professor Glenda Gray, for answering our burning question, which is who exactly is funding the trial of this vaccine on Africans? Who is paying for Africans to be used as lab rats? You notice how she just mentions the Gates Foundation in the passing, like as if the Gates Foundation is just a collaborator. They're equal in this collaboration. We cannot tell exactly from what she says the level of involvement of the Gates Foundation. That's okay. Because she mentions them, actually, it reminded me of this article that I read at the beginning of June. It's the Gates Foundation promising $750 million, not just to any research group, not just to any coronavirus vaccine research efforts, but specifically to the Oxford Research Group that is working on developing a coronavirus vaccine. So the Gates Foundation bankrolled this entire effort, or much of this effort, for the Oxford University that now came all the way to South Africa to test and trial their vaccine on poor Africans who cannot fight back against them. But you know, since then, I've been doing a lot of searching online as well and trying to listen sort of to both sides to understand the rationale behind this effort to trial the vaccine on South Africa particularly. So I've listened to some of the interviews and some of the things that have been said by the research group, the leader of the research that is now going on, and why South Africa happens to be the right place or the perfect place to trial the ChAdOx1 nCoV-19 vaccine. And what everybody seems to be saying, or those who are in support, or those who are running and trialing, leading this effort to trial this in South Africa, is that there is so many deaths in South Africa. So they've convinced people that because there are so many deaths in South Africa linked to COVID-19, South Africa should be the place where the coronavirus vaccine is tested. So of course I did the next logical thing, which was to go and search for the world record and reports on who's dying where and all the death tolls from all the different countries that are linked to COVID-19. And yes, as of last week, when all of this was going on, South Africa had indeed a lot of deaths. As of last week, there were about 2,200 deaths that have been linked to COVID-19, which is a lot of deaths. So, but what I also found out from my little search online is that there are about 22 other countries that have many more, exponentially more deaths than South Africa. There are all these Western countries that have had so many deaths linked to the COVID-19, and I wonder, why is this research not going on there? Why aren't they trialing it on people, say, for example, in Germany, or people in Spain and Italy? Why is it that the Oxford group has picked South Africa, that is all the way down at number 23 or 24 on the list of countries affected by coronavirus? This is just a question that I think is not just for me to ponder, but it's for people around the world to ponder. It is the way Africans are being treated. It is the way Western elites, the people who are running research, the people who run foundations, the people who come with a certain idea and ideology, how they see Africa, how they approach us, because we are poor countries, we're developing countries, we cannot take recourse to the judicial system if something were to go wrong. They are using us for trials, they are using us for testing, they are doing all their projects and experiments on us. But as an African, I say no more. I am calling out to everyone with this video to please rise up and speak out against this. We spoke up very, in a very strong way when Jean-Paul Mira had mentioned it. They gave us like a bit of like a preview of what could go on, that something could be tested in Africa. We had the warning. It's not like this came without warning. We had the warning. We fought against it. We spoke up against it. I am asking people to be aware of what is going on and for us to say, no, the Africans should not be treated like this anymore. People should know about it. People should speak out against it. And these organizations should be exposed. These organizations should be exposed. The Oxford Group, you ought to be ashamed of what you're doing in Africa. To the people who are in Africa, these researchers who are bringing in and opening the door to these people who are going to destroy the lives of our people when things go wrong. I am saying to you, what you're doing is wrong, except if you have a good pathway that we can use to sue when things go wrong. If you are going to offer to these poor people at the same time as a trial, a way that they can come back and sue the Gates Foundation or sue the Oxford Research Group or any other pharmaceutical group that is going to test on us, let us know. If you have a judicial pathway or a legal pathway that we are going to be able to come back and fight for ourselves and defend ourselves, then it's okay for what you are doing. But if you don't have that, and if you are treating us like the way you are treating us because you know that these people are so powerless that there cannot be any consequences if something were to go wrong, and they don't have the platforms to raise their voices so that the whole world should hear them, then what you are doing, you ought to be ashamed. You ought to be ashamed. I am calling out organizations, I'm calling people, I'm calling out Africans, I'm calling people of goodwill from every part of the world to say no more of this exploitation, no more to human experimentation. If you are going to develop vaccines to help people around the world, please don't use Africans, especially when we are not the ones who are most affected. That's what I have to say.